Consults for hair transplant in younger population is becoming commoner in my practice. And I'm seeing a trend where even in late teens, boys are considering hair transplant because they fear that they may get bald in future. So this is something which is quite intriguing to me. And when I actually consult the patients, I tell them that when we are treating a person for hair loss, there are so many things that we must consider. And we must also consider what is the right age for hair transplant. How young is too young? And what happens when we consider hair transplant in a very young person, or let's say in the early 20s versus when we consider them in the early 30s or mid 40s. So I'll break this down for you in this video, and we will talk about what is causing hair loss in the younger population, how to deal with it, whether you can delay the hair transplant by some methods or not. If you are considering hair transplant in your younger age, then what is it that you must be wary of, or what is it that your surgeon must consider when they are planning the hair transplant journey for you? I am Dr. Shilpi Bhadani. I'm a plastic and aesthetic surgeon and I practice at SB Aesthetics Gurugram. And here is the lowdown on right age for hair transplant for you. So let's say that you are in your late teens or early 20s and you're facing hair loss. So what does the road ahead look like? Well, when we are talking about young age hair loss or alopecia, there could be several reasons, from health reasons to genetic reasons. And yes, we are seeing an increasing trend of early age alopecia nowadays. And there could be many reasons for it. It could be your stress, your sleep cycle, your diet, you're not exercising, and you're smoking. It could be anything. But yes, when we are dealing with hair loss in younger population, we first have to get to the root cause of it and then treat it from the cause. If it is genetic and you know that you have a strong family history of alopecia and you want to consider early hair transplant, then there is also a way. Of course, we have to rely on medications to give you a good result, because there is a role of finasteride, there is a role of injectable therapies, and of course, your entire health history has to be checked before we embark upon a surgical journey. Now, let's say that you've set everything right and your health is perfectly fine and there's nothing that you can do medically, and you are definitely considering a hair transplant. So what is the right age? I would say that wait until at least the hair loss pattern has established. Because if you jump in it too early, so let's say that you start having hair loss in this area and it bothers you a lot, and you go ahead and get a hair transplant done only for this area, but your hair loss is progressive and you're going to lose hair from all this area as well. And later on, if you don't have enough donor hair, then you will not have enough hair to cover all this area. And it would look very weird if you have a hairline over here and you're bald from here with no hair to cover your balding areas. So when we are considering hair transplant in a younger population, mid-20s is where I would want to do a full hair transplant for my patient. Yes, if you are younger and you want a small area touched up, like the temporal areas or a bit of the occipital area, it's fine, that's not a problem. But when we are considering a big hair transplant or a major hair transplant, I would wait until the mid-20s or maybe late 20s to do a full hair transplant for my patient. When we are doing hair transplants, we must see what the donor area looks like. If your donor area is perfectly healthy with thick hair, then yes, you can go ahead with a full hair transplant, good coverage in the frontal, and you can have a lower hairline also. But if you are not having good donor hair, then later on in your life, when you lose hair from the wall, from the crown area, there will be less hair to cover this area. And do remember that hair on your head is limited in number. It does not multiply. And that is why the donor hairs are very, very precious. So when you're considering hair transplant in the younger age, you have to rule out medical causes. You have to see what your donor area looks like, what is the hair transplant you are considering. It should not be done only from the standpoint of the present, but also from the future. Because hair loss in younger age, if you're facing severe hair loss and alopecia, then it is most likely going to be progressive. So you must act earlier to at least do something from the medical standpoint and do medications or injectable therapies to slow down the alopecia, thereby delaying your hair transplant for a later date when your alopecia pattern is more established and you can get a lasting result from whatever hair transplant you're planning to do. So if you are young and you are facing alopecia, then these are my 3 takeaways for you. Number 1 is consider hair transplant only when your hair loss pattern has been established. Number 2, donor hair is of utmost importance. Use it judiciously. And number 3 is do medications and injectable therapies to delay your hair transplant and also slow down the alopecia rate. So these will be my 3 takeaways. So having discussed about right age for hair transplant in younger population, I would also like to tell you that the best age for hair transplant would probably be between your late 20s to your mid 40s or late 40s, and even patients 50 and above can opt for hair transplant, although in them the planning might look a little different from the younger age people. There is really no upper age limit. If you are in good health and still wanting a head full of hair, then yes, you can definitely get a hair transplant. Of course, it has to be tailored to your health condition, and it is very important to choose the surgeon and the facility very well, because hair transplant is a surgical procedure. There should be no mistake in understanding that it's a non-surgical and it is a less risky procedure. No, due diligence has to be done in all surgeries, and hair transplant is no different. If you know of a young person who is planning their hair transplant, then do share this video with them, because they need this information before they decide for their hair transplant when they are too young. Thank you for watching.